Welcome back to Strange Animals talking about things around the world. Tonight's subject, healthcare in New Zealand, and I will be your host, American Panda. And we are interviewing Kiwi Bear.
Hello.
So you are from New Zealand?
Yes.
We are in New Zealand?
Apparently.
Are you a healthcare professional?
No.
I see. Do you have healthcare?
I believe so, yes.
Does everyone have healthcare?
Everyone I know.
How much does it cost you to visit the doctor?
I think the copay was only $50 last time I went.
That's pretty cheap. Have you ever had a major surgery before?
Yes, I needed a lobotomy.
How was that?
With general care I was put on a waiting list that was quite long. But the surgery was well done and the technology used was state-of-the-art.
For your lobotomy?
Yes. However, we have private insurance available to us if we want to sign up for better care. The system works rather well in that respect.
I see. How long do you expect to live? Given you have had a lobotomy.
Well, you never know. But given the national statistics, I should make it to my 80th.
Do you have any medication?
My schizophrenia medication.
I see. And how much does that cost?
Well, my medication is subsidized by the government, so it costs only $3 per bottle.
Do you know the average cost for healthcare per person in New Zealand?
Let me check with one of the voices in my head. He is a healthcare professional and might be able to answer your questions better. The cost per person is $2,403 per year.
Oh, I see. And what percent of your GDP is spent on healthcare?
As of 2012 it was 9.2%.
I see. Do you know any doctors?
Well, I am not a doctor, but I have several voices that are. Hold on. Yes, hello. I am a medical specialist who is specialized in brain surgery.
Excellent. And what is your salary?
Well, I am currently unemployed due to an incident where I accidentally lobotomized one of my patients. But before that incident I was making around $200,000 a year.
Do you know what the infant mortality rate is in New Zealand?
I do not, but perhaps the general practitioner would. Hold on.
All right.
Yes, hello. I believe the current infant mortality rate is 500.
500 per thousand?
What? No, that would be ridiculous. 500 per million. Or I suppose how you Northern Hemisphere blokes would put it. 5 per 1,000.
Ah, I see. And how much do you get paid?
Well, it's kind of hard to find work when you are sharing a head with 30 other people, but figures I have heard general practitioners earn around 120,000.
I see. So those seem like reasonable salaries. Who pays for it all?
Well, I believe that around 77% of it is paid by the government, and the rest is funded by private insurers. However, I am not the right person to ask about that.
So as a medical professional, what do you think the best points of the healthcare system in New Zealand are?
Well, I find it great that as a doctor, I can provide quality care to anyone who needs it that is under my care, for little or no cost. It is also nice that our healthcare system is very modernized and I have all the tools and technology necessary to give my patients the best help they can get.
Can you think of any negative aspects of the New Zealand healthcare system?
It would be hard to think of anything bad in our healthcare compared to what you blokes have in the States. But if I had to think of one thing, it could be that Pharmac, the government group that handles what drugs get subsidized, can sometimes make decisions on drugs that have adverse consequences on consumers. For example, if they omit subsidizing one drug, and not a similar drug, but they do not take into account that some patients react differently to similar drugs, they could be inadvertently denying some patients the right to a subsidized drug that works for their biochemistry.
Very interesting. I have heard recently that many pharmaceutical companies are suing Pharmac for anti-competitive pricing, and that some companies are leaving New Zealand altogether. What do you think of this?
While this may be a problem for consumers and lobotomized patients and doctors alike, Yes. Hello, I was once a pharmaceutical economist statistician, and I believe that this product vacuum should attract a new company within no time. But, yes. Hello. However, you cannot deny the possible danger that this may pose to the patient and lobotomized subjects akin. I can smell colors.
All right then. I believe Dr. Kiwi Bear has shared with us all we need to know on the New Zealand healthcare system. Thank you for joining us on Strange Animals talking about things around the world. Next time. Did you know that the item in your shopping cart is deadly? Find out what in next episode Strange Animals talking about things around the world.